Hello, anatomy. Yesterday in our notes, some of classes got a little farther than others, so I just wanted to make sure you had these notes finishing up about the teeth in the mouth. Can't remember exactly where we got. I think we got to here. If not, I'm letting you write them down, and we can talk about them later on. Just wanted you to be able to take quiz 1 today before you really get into the second part of the notes and quiz 2 and all the other activities. So here you go. Looking down inside the tooth, the pulp is the soft center of the tooth. Blood vessels, plenty of nerves. The cementum is the outside. You can see kind of it here. It's not nearly as strong as enamel, but it's there on the outside. Then we got these different things that can happen. Plaque is the soft, sticky substance that's on the teeth. It causes cavities, which are holes in the teeth. When enamel erodes, the root canal is when this red portion here gets removed, typically by using a file. A drill is used right here. You put it in, and a file removes all that stuff, and you replace it with packing material, basically just fake tooth. They don't have feeling in that tooth. That happens when that pulp becomes infected or decayed. I don't think any of my classes got to hear. It's the last slide of part 1. The salivary glands produce spit or saliva. There's several inside your mouth. You can see them in the chart there. Saliva moistens food and also makes it a lot easier for it to chew and swallow. There's enzymes there that begin the process as well of breaking down chemically. All right, so this part of our notes, this is all the next part. You'll use this for quiz 2 and some other things. The pharynx is more commonly called the throat. Sometimes it's not really included in the digestive system, but I think it fits perfectly there. Food passes in through the pharynx after it's in the mouth and moves back here to the back of the throat. And it only aids in swallowing. You do have control of this part of your digestive system, as we'll see on the esophagus, the stomach, the intestines, and they're involuntary. But here, we can choose to swallow our food down or swallow or not swallow it. Okay, so the pharynx is also known as your throat. The esophagus is this right around 10 to 12 inch, depending on how tall you are, how long your torso is. The esophagus is this tube that branches between the throat or connects between the throat or the pharynx and your stomach. If you're looking at the body, it lies between the trachea, the windpipe that goes into the lungs and aids in respiration, we'll learn it, and the spine. So it's in between those two portions, the trachea being more towards the front of the body, and then the esophagus being a little farther back, but not nearly as far back as your spine. It pierces the diaphragm, which is a muscle here. We'll learn more about it with respiration too. Everything kind of overlaps. It pierces through there and then joins into the stomach, which it just joins seamlessly. All right. Now, the walls of the esophagus are muscular, lined with smooth muscle. That's what it talks about down here. Once we swallow in the throat, it becomes an involuntary process. Now, things don't just fall off the cliff and yay, goes down the esophagus till it into the stomach. No, it actually slowly moves. That includes liquid as well. It kind of gets caught up. Our esophagus does a really good job of moving things down slowly so that it don't get clustered up there in our stomach. It's got time to push through. Food is chewed and then mixed with saliva in the mouth, swallowed by the pharynx. The tongue rolls it into something we call a bolus. From there, the bolus, or this mass of food, is going to travel down the esophagus. All right? It passes a structure called the epiglottis. This is a flap that closes up the larynx, which goes to our lungs, so it closes up the respiratory system as food passes through, much like the uvula does at the top of our throat here. Okay, we learned about the uvula, how it blocks off the nasal cavities. The epiglottis does the same thing, much lower. So swallowing, these two close up, causing this to just be one central passageway. All right. It uses something called peristaltic waves. I think we talk about it a little more in a little bit. These are the smooth muscle that pushes things in the right direction. Okay, it just keeps the food moving at a good pace until it evacuates our body eventually. The stomach. The main function, the only function of the stomach, is to break down food. As we look at the stomach, there's 2 sphincters. Sphincters are anywhere on our body. You've probably heard it, with the anal sphincter, most likely. These muscles that are in a circular pattern. Can't really see it in here, but here's a good look at it. In a circular pattern that open and close. Okay, just like a muscle. Most muscles work from one end to the other, and they kind of work in unison between two muscles. All these muscles in the circular pattern work together to either open or close. Two sphincters on either side of the stomach. One's called the lower esophageal sphincter. This regulates our food passing from our esophagus here into the stomach. And it closes up when our stomach gets pretty full, up to about this level here. And that way food can't back up into it. We'll see what it's called when it does here in a few. Okay, that sphincter closes up. The pyloric sphincter is on the bottom side, if you want to think of it that way, of the stomach, and enters into the small intestine. This one typically stays closed until food gets beat around and also chemically broken down inside the stomach. And from there, when it's ready to go, it opens up. The pyloric sphincter allows food to pass into the small intestine. So sphincters on either side of the stomach. All right, what's inside our stomach? You hear about stomach acid, things like that. What is that? What is it when you throw up and it burns our throat and it tastes horrible? What's mixed in there? Some of it's food, or partially digested food. But what's all this other stuff? It makes the stomach lining, the inside of our lining, makes about 2 liters. That's your typical, Coke bottle. 2 liters of gastric juices per day. The rest of it, a lot of it gets passed into the small intestine, broken down, turned into other substances, and just passed out of our body. Of course, it's not going to be as potent as we'll see in some of this. Hydrochloric acid is the main thing that makes up gastric juice. HCl, hydrochloric acid. In this, it's going to activate these pepsin and pepsinogen. It's also going to help break down some of the proteins that we take into our body. We'll see what those are in just a minute. Hydrochloric acid is very, very acidic, of course, but it's able to break down. I can't think of the term right off the top of my head. You chemistry students would know. It breaks down things, right? So if we have hydrochloric acid and we pour it over a substance out in the open, it will eat it away. It'll eat it away. The reason it doesn't digest our stomach in itself is the lining of our stomach is very full of mucus. It's very slick, has a lot of mucus there, and so it actually keeps that thick layers of mucus keeps the hydrochloric acid from getting to the lining of our stomach, or the mucosa. Remember, we learned that's the innermost layer of our stomach. Now, if we don't have a lot of mucus made, there are times that we can get things called ulcers. We'll see those in a little bit or some other day where that hydrochloric acid will get there. Pepsinogen, don't worry about it any more than it's a precursor of pepsin. It helps make pepsin. It activates it from here. Pepsin is what breaks down proteins in smaller pieces into polypeptides, okay? So it takes all these things we're eating, turns proteins into amino acids, which then turns them into polypeptides. So it's just chemically destroying the food that we eat, okay? Chemically destroying it. Once it does its job inside the stomach, it's able to take these bare minimum, smallest type things and move into our small intestines. This is what happens there. Mucus, we already mentioned, makes that protective layer. Now, the stomach wall will absorb some substances such as water. So it does take some water, and from there, where does it absorb it? Into the bloodstream, into these blood vessels that surround and connect to the stomach, the walls of the stomach. Water's taken in. Alcohol is also absorbed there. It does get absorbed later on too, but it is absorbed into our stomach. Y'all are old enough to talk about if somebody is drinking alcohol and consuming alcohol, and they're not used to it, their body hadn't built up a tolerance to it, they see the effects of alcohol pretty quickly because it starts getting absorbed into their bloodstream, even inside their stomach. So mere minutes after they drink it, some of it does start entering their bloodstream, impairing their judgment, giving them the effects of alcohol consumption. Not always a very good thing. And then some molecules as well. The biggest thing we get from inside the stomach is the mixing and emptying of the stomach. Movements of the stomach, I mentioned these muscles inside there cause these peristaltic waves, just like we saw in the esophagus. The bolus that hits our stomach kind of gets mixed around with the gastric juices, and they become this semi-fluid paste called chyme. I have heard people call it chyme before, but I've always heard chyme, CH forming that K sound. Okay, so it's a bolus when it leaves our mouth, this wad of food, and by the time it leaves our stomach, it's called this chyme. You look at what the rate that things empty out of our stomach and move on. Liquids, of course, are the fastest. They stay there for just mere minutes. There's not a lot to break down. The hydrochloric acid and the pepsin work on it pretty quick. High protein foods and carbs pass pretty quickly. Okay, they're relatively easy to break down. Those proteins break down amino acids, break down polypeptides pretty quick. Those carbs are broken down into simple sugars and starches very quickly. The thing that stays in our stomach the longest is fatty foods. It takes about 2 to 3 hours for those lipids to be dissolved. And we see in a minute, it's not even through then. Or maybe not in a minute, maybe next day. All right, so looking at some injuries, a hiatal hernia, you might have heard of this before, is when the stomach actually protrudes upwards through the diaphragm. The diaphragm, again, is that thick muscle that separates all of our abdominal organs and things from the thoracic, the lungs. It also helps us with breathing, kind of causes this vacuum sensation in the lungs. And you more commonly know it as what we use to sing and project our voice. And I have such a good voice, I know. I should quit and become a singer. Anyway, the diaphragm helps with that. What happens is this part of the stomach sometimes can protrude upwards, leaving this little bubble pretend. We have one here, this bubbled up place, kind of backing up the esophagus. Can be very painful, obviously painful to move, breathing, and also digestion because it kind of causes a kink. Hernias will typically go back on their own when you just take a rest, leave things alone. Sometimes you have to watch your diet, and things that upset your stomach can make it worse and aggravate it. Obviously right here, resulting from weakening of surrounding tissue. Those tissues are weakened. There's nothing really causing it or anything, but it can be aggravated by obesity. So you see hernias not always happening just to obese people, but more commonly in obese people. Oh, we did talk about ulcers. Good. A stomach ulcer is a break in the normal tissue that lines the stomach. This could be caused by medications that you're not used to taking, can cause your stomach to somewhat dry out or make less mucus. Stress can also cause this. That's why you hear, I'm so stressed, I'm getting an ulcer. That can definitely cause it. So it can cause a hole to start forming, or at least cracks. And the reason it's so painful is that stomach juices, those gastric juices, start hitting against the lining, the mucosa of the stomach without that mucus protective layer. What was I about to say? Oh, also just too much acidic foods. That's why you might hear people say, you start getting a stomach ulcer or feeling like it, drink some milk, which is very basic. Evens out that pH level of your stomach, and hopefully it starts making mucus once again. Severe ulcers can start to eat through the skin, can cause bleeding, and even actually can go through the stomach. If this happens, bad news city, okay? And that's because we've left that ulcer unattended. We've let it keep flaring up until eventually it's eaten through the walls. The hydrochloric acid is eaten through that weak spot, through the walls. Now our gastric juices are being released in our body. This can be a fatal type condition. Okay, so it's always worth getting checked out early on and seeing if we can figure out a solution for this ulcer. Now, you get an ulcer today, you're probably not going to die tomorrow. Okay, you get an ulcer today and leave it in immense pain for months on time, guys. We're dumb when it comes to pain sometimes. It can eat a hole in your stomach. Heartburn. Heartburn is something that is fairly common. It occurs when the stomach acid backs up into our esophagus. Okay, it backs up. Normally, if our lower esophageal sphincter is closed up, everything's good. Okay, this, even if it's liquid, is not going to be able to back up. If there's a slight opening, this starts backing up. It starts to burn the esophagus. It feels that painful sensation. It can be worse lying down on certain sides of our body too. It's actually recommended if you need to sleep with heartburn, you lie on your right-hand side because it causes this esophageal sphincter to be up in the air. Bending over can also hurt it. Has nothing to do with our heart, okay? Has nothing to do with our heart. Gets that sensation because sometimes it does feel that way in the chest. And I guess when people were naming stuff and giving it common names, it just felt like our heart. Something was wrong with our heart. Probably going to finish these in another video.